Doctors used to be independent thinkers. They were mavericks. They would go to medical school. They had influence, maybe too much power. But what happened? Well, things changed from when I decided I wanted to go to medical school and be a doctor, from watching Marcus Welby, MD, on television as a young child. So what happened to doctors between 1968 and when I finished my residency in 1990 and went into private practice? Doctors would learn all these things in medical school, practice locally, and figured out what would work in their local community and practice that way. They were members of the community, they were friends, they weren't sitting in some office with some corporate logo over their name. When I was applying to medical school, one of the places I could go was a 6-year program, and after discussing that with doctors in Columbia, Missouri, which has a plethora of doctors, most of them said, well, you can go to that school, but you come out with basically an algorithm. Those doctors do the same thing for every person, regardless of their genetic makeup or what kind of a person they are, their background, or their history. Being the maverick that I am, I thought that was a dumb idea, so I did the traditional route of medical school at the University of Missouri and did my residency in Nebraska. In the 1990s, evidence-based medicine came upon us, and everybody thought, well, this is great. There's a cookbook for everything that you want to do as a doctor, so you don't really have to think. You just do that. Still being a maverick, I wasn't going to do that, and that got me in lots of trouble, especially when I became an employed corporate physician, which didn't fit my personality. So once they got doctors used to following the rules, whoever wrote those, everybody thought, well, let's just buy them all up. And then we can make them employees, and they have to do what we say because we're their boss. The reason I didn't make a good corporate physician is I would keep getting told, well, you can't do that. That doesn't follow hospital policy or corporate policy. So I said, well, I'm not going to do corporate policy for that issue because that's not what is the correct thing to do for that patient. So I'm going to advocate for the patient. I didn't get fired, but we did split ways. So if a corporate-owned doctor didn't do what they were told, they could fire them, or they could run them in front of a board, or throw them in front of the medical board. A friend of mine got referred to the Physicians Health Program for anger management. He was an orthopedic surgeon. He got irritated because his sterile field was messed with in the OR by a nurse, and he got mad. So he had to go explain himself to the medical board. That's dumb. Then to get even more compliance, they would financially incentivize doctors to follow these narratives and rules handed down by insurance companies, hospital corporations, or the government. Don't believe me? Look at this from 2021. Let me get out of the way so you can read this and screenshot it if you want. The mavericks are still out there, although they're becoming few and far between, and maybe they're a little older, they've been doing it for a while. So find them and go support them. They're going to work for you and do what's right for you. Have a great day, and I'll talk to you later. Bye.